The donkey itself needs to retire. She said the whole salary went for the diapers. There was one night, the most scary. I thought we're not going to make it. It was so scary. It was non-stop drones and bombing, drones and bombing. They divide the casualties or the survivors there into 3 categories. And they even have like letters for them. The first category is single children with no living parents. Alone. The child is alone. And you talk about 11 or 12. We saw one, they put his video recently on, who was, I talked with him, I think he told me either 9 or 10. He was wearing scrubs. Did you see that video? And I joked with him and I was like, oh, mashallah, the young physician. He looked at me, yeah, I'm going to be an orthopedic surgeon in Arabic. Alone, lost everyone, living in this hospital. What does he do? He pushed the patient's beds to the OR. Where does he sleep? What does he eat? What shower he takes? If there is something called shower, what about the feelings? What about the anxiety? Don't talk about these things. These are luxury. Subhanallah. The day that the World Kitchen, you all heard about it. So Monday and Tuesday, there was no food. From where our room was, there was a window. I can look and I see the street. And the norm mode of transportation is what? A BMW, right? It's usually it's a donkey, and the donkey either alone or the donkey is pulling a carriage. The donkey itself needs to retire. Old, probably not fed, definitely not clean. So I used to see, especially before iftar, and you see one shop, it's not a shop, it's one place at the door of the hospital where they present what they have. And one day my friend looked at me and says, do you see eggs? This was like 4 days after we arrived. And I said, I think this looks like eggs. Eggs. We ran down. I bought 4 eggs and I paid for it $4. 4 eggs. Others, they don't know what eggs means. 2 days, this is all after the death of those, where you can start, because when we came through the border, there were huge line of trucks, all has things, but they were not inside. The next day or 2 days later, my friend was working in the ER, texted me and said, there is orange. And I said, orange? She said, yes. Went down to buy an orange, only one place. I bought 5 oranges for $5. The head nurse of the maternity, and the second one, they all work in the hospital 24 hours. You don't go home in between, come back. It's very unsafe. So they stay for 24 hours, then they go for 3-4 days, and then they come back. And Allah knows if they will come back. So I was with them talking, and I said, where do you live? She said, I live about 15 minutes walk from the hospital. We live in a farm absolutely at the border between us and the other side. And I said, yeah, oh, alhamdulillah, a farm, look at me. And she said, yeah, half of the farm, it's not ours. I said, what do you mean? She said, we cannot get close to it. If we get close to it, we'll be dead. It's like a free zone, but it's their place. And they cannot plant, they can do anything in it. And the rest we can. She said, I had 3 children, and the 3 children got sick. And please forgive me, they had diarrhea. So I needed to buy diapers for them. She bought the diapers for $60. Each one package. She said 180 shekels, about $50. And I said, what is your salary? 800 shekels. She said the whole salary went for the diapers. And there's questions you just can't ask anymore. I mean, human dignity. So she as if she learned, and she figured out what I want to say, and she says, Alhamdulillah, we have farm and we eat from the farm. We used to have chickens like treasure. We used to have chickens, they killed them all. Then I met a girl. As I go to there's stories and stories. As I go in the corridor to go to my room, she, 9 years old, legs is all wounded. And I think they saved her leg. I think the team with us, the vascular surgeon, saved her leg. And as I go, she smiles and she greets you. And what's your name? In Arabic, 9-year-old. So I gave her my name, right? Every morning. Then one day she looked at me and says, do you see how happy I am? And I said, yeah, why? She says, I'm going to go to Egypt to get treated. And I said, who's going with you? I don't know. But at least I'm going to get treated. 9-year-old, what they should be happy for? 9-year-old, right? Literally, those children, their childhood stripped from them. I didn't see a child. I saw a child, but I did not see a child. There's no child whining about ice cream, or the food is not good, or whatever we whine about. Subhanallah. This woman who I told you the day one, that she was on the side of the entrance of the hospital, every time we go for tahajjud, her mattress is right there. And she is sitting on the mattress. So I was like, I'm going to talk to this lady. So one day, actually, this was like 3 days before we leave, somebody got us cookies. They baked it at home. Wallahi, when I saw the cookie, I can't tell you. I was like, cookie, something fresh. Rabbi. Yeah, he was reminding us of what we have and how ungrateful and how we take things for granted. So I had two. I was coming, I looked at the lady and I said, Khala, do you want one? She said, sure. Okay, alhamdulillah. Then I asked her, and she said, from the 7th of October, we were living in Gaza. And everybody, when they tell you we're living in Gaza, like, I was living in California and we had to leave. I took not much with me. And I came in here, and she looked at me and says, I've been living in here for the last 6 months. And I said, where do you go for bathroom? She said, with the patients. What do you eat? Whatever they get me. Where is your family? She said, my daughter with me. She was next to her. And the other are in Gaza. I don't know what's going to happen to us. And you look at her, of course, covered completely. They all wear the prayer. Have you ever seen it? They all wear the same. Everybody. Subhanallah. There was one night, the most scary. I thought we're not going to make it. It was so scary. It was non-stop drones and bombing. And they were threatening that they will invade. And I remember when I was praying my Isha, because that night, I think we didn't go yet for Taraweeh. They said, pray Isha in your room and let's see what are we going to do. I remembered when Allah subhanahu wa ta'ala said in Surah Al-Fath, هو الذي أنزل السكينة في قلوب المؤمنين ليزدادوا إيمانا مع إيمانهم. You all read this. He is the one who sent tranquility to the heart of the believers. We read it, but we don't know what it means, right? I remember that night, I made all that dua to Allah, just make me feel serene. I mean, it's almost impossible, but Ya Allah, you are capable. Make me feel serene, so at least I can pray, at least I can make dua. And khalas, if this is how it is. We're all going to die. But it was one of the most scariest night And this was nothing, because this morning they texted me and they said, you should see the last 2 nights. Because if you heard, now they are getting to the middle. And Nusayrat, the camp, is about 10 minutes walk from the hospital. And they are bombing and bombing and bombing. The day before I left, they said, we can take you to the maternity hospital today. It is a little bit quieter, because this was the day of negotiation. I think it was Sunday when they were in Egypt negotiating. When there is negotiation, usually you get a little bit better, but then it gets very worse. They're so scared when it gets better. They say if it gets quiet, that means we will get it. So I went to the hospital. Of course, you go with the ambulance, and literally you say, La ilaha illallah Muhammadur Rasulullah, because you don't know what is going to come on your head. Streets, no streets, no streets. They're either bombed on the right, on the left. Things are standing, things are lower. We get to the hospital. The hospital looks from the outside still intact, looks nice, new. So when I entered, went to the second floor, and they said, oh, yeah, this is the private hospital. It opened only 2 years ago. We used to do private hospital, so we used to do maybe 5 deliveries a day. And then they looked at me and said, and now 50 delivery a day, because there's no other place to deliver. They do between 9 to 10 C-sections a day. I did 2 in that day. So I go to the OR, and what do I see? And I just did the C-section yesterday here. And when I was doing it yesterday, I was like, Ya Allah, aren't they human beings? Are human beings only here? Wallahi. The woman, they brought her, there is nothing on that table. I mean, if any of you had surgery, you know there's always sheets, and then they put pads, right? It's more comfortable, it's drier, it's humanity, right? So usually this is under. There was nothing under that. They put her on the leather, which is usually very cold. Alhamdulillah, they had anesthesia. They did. And they gave her spinal. I don't know how good it was, because she was feeding, but not shouting, but that's it. And then they opened a green cover. And I didn't say anything, because at that point, I was like, don't think of America. This is very different. For those of you who have seen, or you can go on Google, usually when we do surgeries, they bring the instruments in a container, and the container is usually covered with sheets. It's part of the sterilizing process, right? That's usually in here, is usually taken aside or thrown. And then you have sheets to cover the patient. None. And the surgeon looked at me and says, we are creative. The need makes you think better. I have a picture of it. It's the green, long, they cut it in the middle to the point where you can see the C-section wound. And that was it. Her legs were, not her legs, her foot was shown. Normally you don't. You cover the patient fully. Where is the cautery? It's an instrument we use to stop bleeding. And they said, we don't use it. Gloves. I normally do 5.5. I said, I'm sorry, Doctora, there's only 7.5. 7.5. It's double my size. I did the C-section with 7.5. Do you have antibiotic? They say yes. I said, what do you give them for pain medication? Whatever is available. Then as we finished the C-section, they called us to the recovery room, because there was a patient who was bleeding. What is the recovery room? I don't know if they call it recovery room. No monitors. You know, when you do surgery, if any of you have done surgery or you visit somebody surgery, there's usually monitors. None. There's no blood pressure cuff. And I just literally, you know when you are in a nowhere. So because she was bleeding, and I just touched her pulse. I said, no, her pulse is okay. Just give her a fluid. And there is nothing to hold the fluid in. Somebody was holding the fluid. There is no blood testing in that hospital. Literally, me and Dr. Hina, and I was like, she said nothing. I said, you can do a CBC? She said, nothing. They don't have it. You really have to think, use your judgment. That's how it is. That's how it is. You talk to the physicians and everybody, they say, you know what? That's what we have. We will work. What is the casualties? What is the casualties? They say, the numbers you're seeing, these are the accounted for. They accounted for. There's at least double or triple that number under the rubbles. Or those who were, and it's very gross, the woman who was walking next to the sea, she said, by Allah, I saw dead people and the dogs were eating them. SubhanAllah. And she was right, because there was talk about that. She said, I saw it with my own eyes, and that 12-year-old saw that. What trauma this 12-year-old will have.